The Trump administration is proposing low-cost health insurance alternatives to Obamacare, and Democrats do not like it at all. Now, the plan would allow health insurers to sell short-term policies with lower costs and fewer benefits. Democrats immediately ridiculed it as junk, policies, trash, garbage. Senator Chuck Schumer released the following statement. Since day one, the Trump administration playbook on health care has been to sabotage the marketplaces, jack up costs and premiums for millions of middle-class Americans, close quote. Joining the angle exclusively to explain the proposal is the new Health and Human Services Secretary, Alex Azar. Mr. Secretary, thanks for giving us the first interview. Great to see you. Boy, the blowback you guys are getting for offering an alternative is wild. Nancy Pelosi says Americans purchasing these shoddy, misleading, short-term Trump care plans will be one diagnosis away from disaster, et cetera, et cetera. In other words, it's Armageddon.
The shocking thing is these plans were, in fact, available until October of 2016 during the entirety of the Obama administration's tenure. Now we're bringing them back. They got rid of them at the end of the administration and said you can only have these plans that were 3 months. They cut them down to 3 months, and they don't have any of the Obamacare restrictions in terms of the mandates from the central government. It lets them be flexible so people can get lower cost plans if they choose to.
Yeah, so now you're in these plans that are supposedly health insurance, but it's not really. It's access, but people don't go to the doctor as much because the out-of-pocket costs are so high. The deductibles are so high. I keep hearing this from my radio listeners who call in and say, like, Laura, I have insurance, but it's $3,600 before I can take advantage of it. Are those people, like kind of the middle class, that were stuck in that area of the economy, or they're going to best benefit from this?
So we think a couple different groups of people could benefit from this. First, there are people for whom the Affordable Care Act, Obamacare's individual insurance plans are simply unaffordable. You know, premiums doubled before the end of the Obama administration.
Nice.
So individual market premiums have soared. So for many people, the plans are not affordable to get, and what they get may not be real insurance and good enough in terms of that kind of high deductible you're talking about. So for some of those people, these less expensive plans, often 1/3 the price of Obamacare plans, might be a good option for them.
So pre-existing conditions, what happens?
So these plans don't have those Obamacare mandates around pre-existing conditions.
So the plans don't have to accept if you have, like,
they don't.
I have lung cancer, take my case.
So for somebody like that,
yeah.
Other options would probably make more sense. But for other individuals, these may be the cheaper options. Young people, healthy people that are already being shut out of the Obamacare marketplace.
Because of the cost, high cost.
Because the way the plans were structured, the premiums are so high for the young and healthy, they've already been driven out of the marketplace. You know, our opponents on this talk about this as if we're right now living in the land of milk and honey and everything is perfect and nobody is lacking insurance. We're talking about the 28 million forgotten men and women who do not have insurance, that were promised affordable insurance. And President Trump, with his executive order, demanded that we come up with solutions and options like this for affordable, individualized health insurance.
You guys are just trying to kill off Obamacare. That's what you're trying to kill it off. And America's health insurance plans, a big industry trade group, they said, we remain concerned that expanded use of short-term policies could further fragment the individual market, which would lead to higher premiums for many consumers, particularly those with pre-existing conditions. Now, why are they so upset about this, Mr. Secretary?
Well, the National Association of Insurance Commissioners was in the past very supportive of these efforts to increase these affordable options for people. We're trying to just make options available for folks who've been shut out of the marketplace. Now, we need to keep working to build a different system than Obamacare. But while we have it, we need more affordable options for people to get the insurance they want, not what I tell them they should have.
Like, why should a 55-year-old man who's unmarried have to pay for birth control in his policy? Like, why is that something that...
Well, we want to make a system where people can buy the insurance that they want. Now, We need to work with Congress to be able to do that. That's the
This is
repeal and replace
rulemaking.
debate.
So this is a rulemaking. So you got 60 days of comment period.
Yep.
And then it goes into effect after.
Well, then we would review the comments and go to a final rule, and then that could be effective perhaps later this year. But these are things that we can do while Obamacare is still in place, things that we can do to help make insurance more affordable, at least give options to people. Like, let's say you lose your job and you're in transition.
Whoa.
Well, I don't want to.
No, I actually pay for my own house. I mean, I'm actually one of those individual marketplace purchasers, and my insurance has gone up like 47%, something like that. It's crazy.
Yep. So if you lose your job, these kinds of plans can be
saying
helpful
that,
for you.
Okay.
If somebody else loses
Yeah,
their
thank
job,
you. I'm much happier with that.
These kinds of plans can be helpful for you as a transition. And so what we've said is we're proposing that these plans would be available for up to 12 months for people.
So
short-term plans.
So could you re-up after 12 months or no?
So we're actually asking for comment on whether we have the legal authority to let people renew their plans.
So that's a new health alternative. So young people, people between jobs, middle-class people, the poor people already get covered. They get the Medicaid, they get a coverage, but it's that group of people. I don't understand how you're getting trashed. Are you having fun at your job yet?
I'm loving my job.
You are loving it? He was former general counsel of HHS. He was former deputy secretary of HHS, former law clerk Supreme Court, former top executive in business. I don't know who else could be more qualified for this job, but great to see you. Thanks for coming on.
Thank you.